That was wonderful. We're going to come back to that theme. And I think the people who have been looking at integrating good education and good research with Ayurveda have been talking about the only thing that will work, which is to be patient-centered, because everything else seems to come from another priority or another agenda. And when we keep the patient in the middle, it seems like everything goes well. And that is certainly what many practitioners of multiple sciences of healing say, is that when they keep patients in the middle, that's what helps. So we turn to Dr. Sintija, if you could make some comments about your training as a modern medical allopathic doctor in Eastern Europe, and then having traveled around Europe extensively and coming to India to do your work for your PhD, and how those interfaces have happened, and what do you think of both Leah's comments and Dr. Kishor's comments in terms of the agendas and issues and challenges in education of Ayurvedic students and medical doctors? Dr. Sintija.
Hello, everyone. Hello. Can you hear me?
Yes.
First of all, I want to thank Madanji and everyone for this opportunity. And my respect to all the practitioners of Ayurveda. So, few words about myself. I have been studying Indian philosophy for the last 35 years or so, mostly from the aspect of yoga, bhakti yoga. Later on, I got deeper into medicine, into Ayurveda. I have a degree in allopathic medicine. I'm a board certified doctor in internal medicine, and also I'm practicing endocrinology. Mostly I'm working with diabetes patients, type 2, thyroid patients, obesity patients. I'm working both at the government hospital, main hospital, university hospital, and also an outpatient clinic. Regarding Ayurveda, I have studied for many years in Ayurveda pharmacy, Coimbatore. And we have a lot of collaboration work regarding type 2 diabetes. At the University of Latvia, we have Institute for Indian Studies. I'm deputy director of that, where we are mostly working with educating the postgraduate students, so adults basically. Allopathic doctors, we are teaching Ayurveda. There are about 120 graduates currently for our course. So they are full-on practicing allopathic doctors who have studied Ayurveda, and they're using it as integrative practice in their work. Also, we have courses on yoga, on Sanskrit, Hindi, Indian traditional music, dance. So my points which I wanted to make, and I would like to apologize straight away. I have been holding it on for long enough, so I may make some strong points. I do apologize. It's not meant for anyone personally.
Please don't apologize. We are here because we all feel very strongly. You saw how Dr. Kishor was very pointed in his remarks, despite being a professor at an Indian university. He was very clear. So please do. We welcome you, and we cushion you. We cushion you for those.
So, first of all, I would like to start with a few rhetorical questions. Question number one would be, what is the goal of this discussion? What is the goal of Ayurveda globally in 5, in 10, 15, 20 years? That would be like question number one. So, because if we answer this question, then we can see where our discussion goes. So, what I feel is some points which I have met from both sides, because there are moments you feel you don't feel support from allopathic community, or you don't feel support from India, from Ayurvedic community. And how is that? So there are many positive points, but I will just concentrate on problems currently. So problems which I see is, again, a rhetoric question. How many of you have heard from your teachers in India, very respectable, Gurukula trained old Vaidyas? Have you not heard statements like, we don't need research? Do we really need research in Ayurveda? Do we need to prove to anyone that our 5,000-year-old knowledge works? Well, that is the question number one. Do we need the research at all? Of course, also in the West, we have a lot of people who are very interested, who are very supportive, who practice or who come for consultations and who are ready to accept it. Perhaps we don't need to prove anything to those people because they're already open-minded. The issue is with people like allopathic community, with people who are not at all ready to accept it, who basically are very, very conservative and very negative about any kind of complementary medicine from their perspective. They put Ayurveda in the same basket with homeopathy, in the same basket with any non-evidence-based medicine. And do we not need to explain to them more? That is one issue where I meet, which I find is as a problem. For example, if we want to do some research, like a study on type 2 diabetes with a placebo-controlled group, I have heard comments, do we really need a placebo-controlled group? Because it's actually unethical not to give real medicine to patients. So only studies we managed to make would be crossover studies so that both groups at some point get real medicine. So such situations I find we need to talk more about, because we really do need research. We do need evidence. The whole Western medicine, I would say most of Western doctors are a lot connected with pharma industry. And there is a lot of push also from pharma industry for Ayurveda not to come into West, because there will be losses on the pharma industry part. So the short answer is we really do need that research. And we don't need to prove anything to people who already believe in Ayurveda, but we do need evidence for a conservative allopathic community, because they are the people who talk to their patients and who tell to their patients to go along with Ayurveda or not to accept it. So for scientific community, we do need that evidence. The next question is regarding students who graduate in India, who study Ayurveda currently. Professor Patwardhan very correctly mentioned, there are institutions which are great and there are institutions who are so-so. So the question is, what is their knowledge regarding integrative medicine? What is their knowledge on allopathic part as well? Because reality nowadays is that most of patients will be using polypharma. Most of patients will be using some Western medicine. It is just reality. So where I find it quite big problem is that nowadays Vaidyas do need to know about Western medicine basics. I'm saying just basics, how those medicines work, how they interact with Ayurvedic medicines. Will it be synergic effect? What kind of effect will it be from specific medicines? So that is another issue which I would like to address. The next point is regarding terminology. We have been working on a Sanskrit dictionary between 3 languages, English, Sanskrit, and Latvian, specifically for yoga and for Ayurveda and for Indian music and dance. So that is our small, humble effort to make those terms, not only traditional terms, but also try to explain it in modern terms. We have used all traditional explanations. We have added like Sushruta, Charaka, Ashtanga, but also modern. We have made attempts to make a modern explanation, because where I see a problem, it is just a problem of wording. Problem in communication is when it comes to explaining Ayurvedic terms to Western educated people, because most of the time there is like a block. They just don't hear more. If you start telling them that the dosha is humor or kushta is leprosy, that's end of discussion. Or that's just end of discussion, because it's just a joke. Those terms, if we can use more appropriate from their to their ears, more appropriate modern Western explanations. I find that we really need to work on that if we want any global acceptance. If we just want to sit inside our bubble, it's fine. But if we want a global acceptance from people who are conservative, we need to speak, we need to be humble enough and open-minded enough to speak the language which they can hear. Because one more small thing, not only regarding Western medicine, but also regarding Western diagnosis. I have had so many occasions when very good Vaidyas very freely use correlations between Ayurvedic terms or Ayurvedic symptoms and Western diagnosis, and they use them in a wrong way. You cannot accidentally mix up type 1 or type 2 diabetes. You can't accidentally mix up hyperthyroidism with hypothyroidism, or you cannot give a class to a group of psychiatrists, for example, and make mistakes about epilepsy. You cannot do that because that's end of discussion. So these things, it's kind of a question of mutual respect. On a positive side, which I wanted to emphasize, is that during our studies, like what we have just small aspects, we have noticed how much can be used if to just get deeper into those things. For example, when it comes to diabetes, just metformin. It's a standard medicine, everybody's using it all over the world. So if there are side effects, gastrointestinal side effects, we would stop using it because we can't use it if people have diarrhea. If to use just a few Ayurvedic medicines, just a couple of Ayurvedic medicines, which are actually registered in Europe, which are registered in Latvia, they're available, and just to see it from Ayurvedic perspective, you can still continue metformin and the side effects are gone. Same about so many other medicines. Ayurveda, if to use it in an integrative way, many side effects of Western medicine can be gone. In diabetic patients, diabetic neuropathy, chronic UTI, so many things can be taken care of. We can slowly remove allopathic medicine. We can even stop taking some allopathic medicine, but it's a slow process, and it's a question of cooperation between Vaidyas and between Western doctors. So that was I could talk a lot more, but I would like to stop here and just with humble request of mutual respect and mutual cooperation, or elsewhere we will get nowhere.
So Dr. Sintija, these are very good points. Can I ask you, if you could, to give an example of how you would explain the interplay between metformin, for example, and a couple of the diabetic or madhumeha herbs in Ayurveda, and how you would explain that both to an allopathic doctor and to an Ayurvedic doctor and to the patient? How would you explain the physiology or the dravya guna, the medicines?
So in a very simple way. I will not get into specific herbs, but just to say that in Ayurvedic, from Ayurvedic perspective, which we can easily to explain to allopathic doctor or to allopathic patient, there are some symptoms. We don't look at the name of disease, we look at symptoms. And if we see that metformin creates side effects, which are very similar to inflammatory bowel disease symptoms, so if we just look at it in that way, and we give a couple of herbal medicines, which we would normally give to a patient with inflammatory bowel symptoms, that would actually be sufficient. And same we have observed in so many patients, because people do develop antibiotic resistance. Same in India, same in Latvia. People have been on multiple antibacterial drugs, and you just give them just a couple of Ayurvedic medicine and then UTI is gone. You can prove it, like on test, it's gone. Symptoms are gone and in test it's gone. So these things, it's evidence, people believe in it. We only need to collect that evidence, we need to show it, we need to publish it. So
what you've just demonstrated is practice-based evidence. And there's been a lot of talk over the last few years about evidence-based medicine, EBM, which the Cochrane collaboration and many allopathic doctors emphasize, and this idea of practice-based evidence as the new frontier, but really the old frontier of how we should actually look at our patients. So that was a very wonderful interface between what Leah was saying. Leah, I'm wondering if you can chime in how you explain yoga therapy and the language of yoga therapy and its physiology, or how it works with what you use in your Ayurvedic herbs, and then the backdrop of most patients today who have some interface with the allopathic world as well, and they're trying to piece together, maybe if you could use any disease, but diabetes certainly would be a great one.
Thank you. Thank you. And I just want to say again, it's just amazing to be here and with this incredible discussion that you're moderating, Bhaswati. So for me personally, that's a huge concern, because we're seeing more and more and more clients coming in that are on just cocktails of, I'm not even going to call them medicines, I'll call them drugs. And it's, as we all know, it's just been increasing over the years that I have to just work with all of the massive side effects and sort of deciphering what's going on with all the drugs that people are taking before I can even get to a place where I can treat them from what their original complaint was about. So that's harder and harder to navigate as the years go. And what I often use, because it's also very safe, is breath work. So that's my way in. I can feel and see and observe in people's breath where there are imbalances and where there are, I call them fires, not good fires, off-putting fires. I can see all of that in the breath. We can also see it in the pulses. And so that's often a place where I begin, because not only is it safe, it's also new for the client, very usually. It's new for the patient, or it's new for the client. So it allows them to think about, again, their health and their sensations and how they feel in a very new way. So I often begin there. Also, as you're mentioning, I often use any or several different kinds of Ayurvedic interventions, including herbs, including teaching people about DINacharya right away, which I find extremely useful. So I tend to interface yoga and Ayurveda in very simple ways, in very like life-promoting ways first. And it's often because I'm trying to navigate a lot of medical history that is not addressing people's health or wellness in any way. So it kind of begins there. I also want to say there are great misconceptions about what yoga therapy looks like. And on this discussion, I don't remember who, but someone was saying that we can't really consider yoga therapy a treatment because not everybody can do all the postures. And so I just wanted to put that into the discussion, that is a sort of ridiculous way, excuse me for being so bold, but it's a sort of a ridiculous way to consider what yoga therapy is. And at the same time, it reminded me of the misconceptions that people have about Ayurveda here. I've heard people say things like, oh, I can't do Ayurveda because I don't like spicy food. That's amongst the the biggest misconceptions. There's just a total non-understanding of what the practice even is, at any extent. And I feel these miscommunications then between yoga and Ayurveda and yoga therapy, that when I'm choosing a therapy for somebody, it's exactly for that person in that moment. The beginning of a back bend could be this for some people. Some people can't even do that. The beginning of a back bend for somebody might be this or this. That's relating to the back of the body. So what yoga gives us is a place to start that is very safe no matter where anybody is. And I don't think there's going to be a drug interaction for somebody doing this, So it's a lovely place to start that feels safe, but that using the methodology of yoga, which is then breath and rhythm and movement and intention and focus all together, we see incredible changes from session to session. And we used to just in New York, we used to see this incredible interdisciplinary service being done, where different practitioners of different modalities were starting to work together in beautiful ways in New York when there was patient-centered care. So I want to put that in there. When there was truly patient-centered care, then we could have an integrative approach that allowed all of us to be safe and respectful of somebody's healing experience. So what yoga therapy allows me to do and allows patients to find is a place to begin that's based on their own breath, based on their own rhythm, based on their own safety, and exactly from where they are. It has nothing to do with looking at a photo of a posture and supposing that everybody can do that. That has nothing to do with the teachings of yoga or what we now call yoga therapy, in the same way that these misconceptions about Ayurveda have been beautifully spelled out in these in this forum. That's just some of it. I could go on.
Yes, and we'd like to have everyone go on. My job is to make sure that we don't go too much over 90 minutes and to still get some robust discussion in. One of the things that both you and Dr. Sintija brought up is the issue of translation. So I want to move into that idea of really understanding what the science of a medical system is, whether we're talking about yoga therapy, whether we're talking about a particular disease and how it's seen, or whether we're talking about language to language. So Dr. Sintija brought up the idea, or the project, which is a Latvian, English, Sanskrit, dance, and music oriented dictionary to help people to understand the concepts. And certainly there are many translations. I'm wondering if Dr. Kishor, well, I think if Kishor is there, if you could talk a little bit about translations of books and how that's affecting education. And then Madan, I think you wanted to say something about translations after that. Dr. Kishor. Oh, I think you're on mute. Sorry.
Yeah, sorry. Yeah.
Yes.
So you're asking me about the quality of translation of the textbooks of
I'm
Ayurveda.
saying about education, because your theme is Ayurvedic education in your slides.
Right.
So can you talk about how students are affected by these translations of concepts, either done well or not done well?
That is something. That is something really, really serious issue. You know, one of our papers focuses entirely on this. Like, for instance, Madanji knows that about that paper, which was published in one of the journals of American Physiological Society, the history of discovery of blood circulation. Why did the contributions of Ayurveda to the history of discovery of blood circulation went unnoticed? This is the question that we have taken up. And one of the important aspects was that that we have touched upon is the wrong translations. For instance, Rakta cannot always be blood. Rasa cannot always be a plasma or whatever, right? It is not always. So contextual understanding and contextual translation is something that is very important. And most of these erratic translations come from the background knowledge of ancient Greek medicine. Most of those historians, they had this idea about ancient Greek physiology, and they tried to superimpose their knowledge on Ayurveda. For instance, the cardiovascular physiology can be found under Rasavaha Srotas, not under Raktavaha Srotas. If you simply try to correlate Rakta with blood, then you are going to completely miss out the physiology of circulation in Ayurveda. It is described in Rasa, not under Rakta. So how this Vyanavayu takes out the Rasa Dhatu from the Hridaya, and how Samanavayu, it takes back this Rasa to the Hridaya, is something that makes the circuit complete. And if we simply translate rasa as maybe sometimes even plasma or sometimes maybe lymph, then we are going to miss out all these very important and crucial contributions. This has to be done very, very carefully.
Thank you.
Thank you for asking that. Yeah.
Yes. And I think these kind of detailed explanations take us from a place where we're talking about general themes into the actual specifics, which allow us to find ways in which we are going to find solutions. Because most of the seminars that we're seeing, people say something should be done, something needs to be done, something needs to be changed, but the actual issues are not discussed. Madan, you wanted to make a comment before we go into the next question?
Thanks, Bhaswati. Thanks, Kishor, for highlighting those few very precise points about errors in how we understand this thing. This is a question to a piece of information for all of us here, follow on from where Sintija stopped. Sintija Institute there, the university, have done a very wonderful translation of Ashtanga Hridaya. Sintija might add to this. I just wanted to flag this up and also connect it with Kishor's comment about translations, whether the spirit is captured. And we are very fortunate to have with us here Professor Prasad, who has trained with one of the legends of recent Ayurvedic history, with Sri Thirumalpad. I wish to bring Prasad also into this discussion. So if I look in here, the question of translation and the spirit that Kishor has highlighted, and thank you, Bhaswati, for bringing this up. So two things. Sintija, a comment about where the translation project is, particularly the Ashtanga Hridaya project, and whether anything else has happened. Number two, for Professor Prasad to just come in here to take on where Kishor stopped. Thank you.
Let me frame this question, because I'm actually going to bring what I want to give as an example. Dr. Prasad, if you could, Vaidyaji, if you could be listening to this. When we study diabetes, as an example, we learn from modern medicine that it's about insulin, and it's about resistance to insulin and a lack of insulin over time, and the body's lack of responsiveness to insulin. And therefore, we have an increase in blood sugar. And so the treatment focuses on decreasing blood sugar and working on the sensitivity of tissues so that the blood sugar can get into the system. That is the modern medical way, briefly, of understanding diabetes. In Ayurveda, we talk about the doshas, and we talk about how when they sit in the dhatus and form the dhatus have a robustness of function and of morphology. And when they don't get proper nutrition, either because the fire in the tissues preceding them that make them are not proper, or when there is a lack of nutrition, or when there is too much ama buildup, those toxins or that lack of fire creates a meltdown of those tissues. So the dhatus start to basically liquefy. And as they liquefy, they go to the bottom of the body and they start to drain out. And therefore, they start to lose their robustness. That is the way that we, briefly speaking, understand diabetes in Ayurveda. How do we reconcile these two very different ways of looking at things? And how would you speak to the Ayurvedic student to understand both what the allopathic way of thinking is, and then the yoga way of thinking, which is that the energies are off in the body and that the tissues are not together. So the patient's experience is that their muscles move away from the bone, and that there's what we call sautilya in Sanskrit, or loosening of the bone muscle interface. That's the way yoga therapy looks at it. Vaidya Prasadji, if you could come and talk to us about how would you educate between the different systems.
Thank you Bhaswati ji, thank you Madan ji, hello Kishor ji, and hello all. Namaste. See, we have only 3 doshas and innumerable number of diseases. So the interesting point that we have to understand is how these doshas are going to get interacted with the dhatus. They define what the vyadhi is going to be, whether it is madhumeha, whether it is prameha, jara, raktapitta, or whatever it is. Am I audible? Fine. So I think what we have to understand is what or which dhatu is involved in a particular disease spectrum. Prameha, what is explained in Ashtanga Hridayam or classical other textbooks in Ayurveda, need not be the diabetes mellitus as such, but it is a spectrum. But there are some specificity in that spectrum. That means the kleda element which is getting formed from one particular dhatu, that is getting afflicted. and that particular dhatu is Medo dhatu. So the kleda which is formed out of that transformation, the parinama, the paga of Medo dhatu is going wrong because of two factors. Number one, it can be acquired from that level of Agni, Jadharagni itself, where the mechanism starts from the Rasadhadu itself. Number two, it can be inherited. If you go through Madhumeha Chikilsidam of Susruta Samhita, the first statement you should listen. It is a very bold statement. Please remember that it is written maybe 3000 years ago or whatever it is. Even if it is yesterday, it doesn't matter. The statement opens as Dvau Pramehau Bhavataha. There are two types of Pramehas. One is Rasanimitta and the other one is what they have inherited. So this mechanism in which the kleda formation as part of the parinama of Medo dhatu into the Medo dhatu and from Medo dhatu, that is going wrong, and it is not just a matter of a problem with some simple element that can happen at the level of the endocrinology or something like that. So that way we should have an understanding about which all diseases can happen at the level of each of multiple things. Number one, at the level of each dhatu. Number two, at the level of the junctions between dhatus. Number three, during the passage through the srotases. So three variables there. So 7 dhatus with 3 variables plus 3 doshas. So if you have got some basic understanding in your formative year itself, formative period itself, that how a disease program is deciphered according to Ayurveda, you can have a precise understanding of at what stage this particular patient is. Is it is a sahaja problem? Is it is a doshaja problem or jataja problem or whatever it is? So that sort of an understanding we need at the very beginning itself. After learning what diabetes mellitus is and what is type 1 and type 2, when you try to look through the glass, which is a colored glass of diabetes mellitus into prameha, you will be looking for whatever is explained in the modern examination, and whenever you find that okay, certain things are okay with whatever judgment or whatever yardstick you are using, you feel comfortable. But that is not enough. You have to understand the way in which that basic mechanism of samprapti is explained according to Ayurveda.
And Dr. Prasad, could you re-explain that if you were speaking to a group of modern medical doctors, either somewhere around the world or in India, who don't know what prameha is, or who don't know what kapha is, or who don't know what kleda is? How will you do that translation?
It is a big issue. It is a big problem. That is why I insist on the importance of dialogue. And I hope Dr. Sintija also stressed on that point. What we need is not the Vaidyas getting involved in research of modern medicine. Let Vaidyas do their part of the, or their cup of their piece of the cake properly. But we need researchers. If I'm right, Dr. Kishor Patwardhan is trained like a Vaidya scientist. So he is on the transition zone. Then there may be pure scientists who are not related to Vaidya. So let us all sit together and initiate a dialogue. Don't ask the Vaidya, who is an excellent clinician, who is having a thorough knowledge about of what Ayurveda is, who can show you the outcome of his intervention, to explain all these things in terms of a language which is totally bizarre for his understanding. Let us sit together and involve in a dialogue.
That's a very good point. And how would you have that dialogue between people when they are not clinicians? For example, I'm going to draw in what Leah said about the common place where people can see diabetes is in that patient-centered care. So is that the way, is that the place that we can actually explain and sit at a table together. Because I have tried to have people sitting at the table together who are scientists, biomedical, who are clinicians allopathic, and who are clinicians Ayurvedic. And that triangle ends up breaking up in chaos most of the time because they don't speak each other's languages. So where is that language where everyone can sit in a trialogue or a larger discussion?
That is where people like Kishor Patwardhan ji matter. We need that bridges. We need that transitional links where we can have that some sort of a, see, we communicate in many other sectors, no? In music we communicate, in business we communicate, in politics we communicate. Then why don't we communicate in Ayurveda or medicine? There can be n number of people in between to make the communication, the articulation proper and precise. But there should not be prejudices. We should not be preoccupied. We have to keep our cups empty. Then only we can add something to it.
Bhaswati, Prasadji, thank you so much. I want to bring in here Dr. Srivatsji, who is also very important. He was the principal of the college in Coimbatore, and we are so lucky to have Srivatsji. Prasadji, please don't go away, but I want to bring Srivatsji into this, into the discussion.
Sure.
Srivatsji, please. Srivatsji, you are ready. If you are there, please.
Hello.
Srivatsji, namaskaram. Thank you so much for being with us. You have, we are very happy to have you, very lucky to have you, and we are very lucky to have Bhaswati-ji asking these pointed questions, Vaidya Prasad defending very nicely. Kishorji is here with us, and Sintija too is here. So Srivatsji, if I may introduce, was principal of the Ayurveda College in Coimbatore. One of his passions was realized recently with the Institute of Ayurveda Sports Medicine in Thrissur. And Srivatsji was also involved with Ayurveda in the Andaman Nicobar Islands, if I remember correctly. So Srivatsji, please, guide, please. I hope I have introduced yourself correctly.
Good evening to all. I take it as a privilege to be talking to you all. I consider myself as a, Bhaswati-ji knows, I consider myself as a jack of all trades and master of none. But still, I am happy that people are open to the dialogues. As Prasadji put it, it has to be taken much more seriously. I appreciate Bhaswati's comment, which I think reflects her experience in, if I'm not bothered to tell, in Banaras, I think. Always the dialogues ends up in chaos, as she told, because it's a question of Tower of Babel. I don't understand what you mean. You don't understand what I mean. This is the situation. That's why Prasadji told that when Sintija madam told that we should have the regards and respects, that communicates something, because it is always expected that Ayurveda is explained. I put an example of, say, I write a good poetry in Malayalam or my local language, Tamil. And it is being verified and tried to be understood in the grammar of English or applying the grammar of English. This is something which is very absurd as far as truth is concerned or Shastra or science is concerned. So, regard or this thing, respect for anything what we learn is to understand. Very good example is their adaptability is some of the one thing which we can see that. See the instrument called violin. It is a European instrument, but now in Carnatic music, it is inevitable. It is a accompaniment which has been adapted into the terms of Carnatic music, and it has suited much more than any other instruments because of the adaptation which has been brought out. It has, rather we can see that the players of the instrument or the instrument itself has converted to be understanding the nuances of the requirements of the Shastra of Carnatic music, and you don't see that there is any disparity. You don't feel the disharmony, or you don't feel the orchestration is proper. This orchestration, as Prasadji told, that there should be some people who are involved in that, like I know Dr. Madanji and Dr. Bhaswati, who are all talking now. They are all into understanding and understood the way in which, that's why I told that it is the difficulty. I find that even in its land of origin, because of the most of the literate, so-called literate crowd in India looks down upon its own knowledge base, or they are literally unaware of it, and so illiterate about the Indian contributions or Indian sciences, or the way in which it is thought about. Yesterday there was a discussion, I think Prasadji himself was in another session was putting, I would like to quote him, told that speciality in Ayurveda is something different. I then put a comment on that, say, where we think of something reductionism in the concept of holism or holistic reductionism. This is something where, see, the approach or the perspective of looking at things, when you look at the thing from the top, it looks like that. When you see it from one side, left side, it is like this, right side, it is like this. So from where you are looking up, that is very important, and the perspective is very important to understand the truth. And once somebody is mentally tuned to think like that, then there is no question of egos or misconceptions. All the misconceptions will go off if we try to come to a platform where we talk or understand the same language and the communication is go through. So this is what I have to tell, that it's not a very difficult thing, I believe. I know that Bhaswati will agree that many a times it is just translation on the superficial level. Don't think about you don't talk the Tattva level, Shastra level and the Vyavahara level. Every point, the Ayush Kamyam and Prasadji will be happy to hear that each and every word is the opening or is the teaching of the language of Ayurveda. Now what we are doing, we are just jumping into Nidana or pathology or Chikitsa or treatment and then starting from there downwards. It's something you don't know the scientific terminology of Ayurveda and then have some concept that this is this and then go on building a edifice which is foundationless. So it's absolutely, whether it is literary research, clinical research or any research at any level, I think there should be some thing like the bamboo does go deep into the soil and then come up showing the shoots properly. So I just put that.
Shivasji, let me ask you a question. How would you respond to the Ayurveda graduates who are in India or living around the world who say that there is no basis for Nadi Pariksha or for Marma therapy because they didn't learn it as part of the CCIM curriculum, and that there's no clinical use of Rasa Oshadhis because it was taken out of the CCIM curriculum? How do you reconcile those things that are missing or changing in Ayurveda research and trying to make it more modern with what Ayurveda actually is? How would you explain that to the young Vaidyas of today who are increasingly more doubtful about the basic tenets of Ayurveda? And I open that question to any of you on the panel, but Dr. Srivats, if you could talk to that issue.
Thank you, Bhaswati ji. You had drawn me. I just wanted to prevent myself telling about Marma. But you
all roads lead to Marma for you, sir, so please.
Yeah. I tell that I am an Advaiti in Ayurveda and everything is Marma, and Marma Paripalanam is Chikitsa or Swastavrata or whatever it is. Prameha, I tell that it is Vasti Marma is the thing to be taken care of, and Paripalanam, Marma Paripalanam, when it is told, you know that protection of the Marma is more important, and that is the aim of treatment or good living or whatever the principles of Ayurveda tells. Okay, then Marma, when I tell about the prana, and that's why I become a Advaiti on that. That I tell that only one dosha is there, and that is Vata, on which the other things are dependent on. Okay, so that's something. One thing I tell Bhaswati ji is that unfortunately the CCM curriculum, I don't blame, because I had been the academic head and academic administrative head. But the BAMS course is designed to make something called the barefoot doctors, who are a masala of whatever is required for the public or rural health sector, where whichever is government plans are there, government programs are there to implement that. This BAMS syllabus helps out. I think Prasadji will agree. But it is not the, once we have made a very common syllabus for undergraduate education and postgraduate education in India, actually the knowledge base of Ayurveda in the region wise or local regional wise and the vernacular basis or the local language base, it has decreased. Kerala has lost its Marma Chikitsa, Kerala has lost its Visha Chikitsa, Kerala has lost its Bhala Chikitsa, where you can see that there is explanation of just a little number of Visarpas in modern, in the basic textbooks were 50% the local textbooks. So the knowledge base has to be rediscovered in India itself, or I think that BAMS syllabus helps for that, for basic understanding. Unfortunately, because predominantly more than 50% the teachers are happy to teach the modern subjects or the modern correlationship, again the students are carried away, and they are always there is a issue that people are learning this only as a, most of them or 90% of them, as a profession to earn some rupees or dollars or whatever it is. So the question remains that only 10% remain who go deep into the subject and want to understand the pada. Even the dravya, when it is, the word is translated into material or matter, it conveys half only. That's why I put a comment that asti, when I am into asti also. If you ask whether it is asti is bone, it does convey only 50% or less than 50%. And Marma is a difficult subject, as you know, to explain to any Westerner, because you talk more esoteric or it is like a mysterious thing. But it is really, when you understand the prana, it is much more easy. So we understanding the prana.
I want to ask you, sir, do you really think that all Westerners have a difficulty with understanding Marma? Because Leah, I think you might, sir, I'll just interrupt you for one moment. Leah, could you talk about whether or not Westerners really don't understand Marma versus the Indian BAMS?
Well, you're sort of handing that to me, but no, Westerners do not have a difficulty understanding Marma. I would not say at all. In fact, this brings us back to competency and practice, because as soon as we work energetically, Marma is there. It's beyond even language. It's beyond even Sanskrit language. There are energetic languages, and they're in us, and they're far away from us. So no, I would not say that's true. I don't think that Westerners have a hard time understanding Marma. And in fact, in my yoga training, we look at energy languages. Even it's a smaller program, but even within that smaller program, we begin to look at energy languages. And because we're trained in yoga and in breath, the students are able to understand basic Chinese meridians. We also look at the yoga nadis, and we also look at the Marma points within one short yoga course. And people have very keen sensitivity, I have to say, very keen awareness and keen sensitivity, because we're coming in through breath, and because we're coming in through a somatic and kinetic experience of how we live in our bodies and how breath lives within us. So no, I would not say that that's true.
Thank you. I would like that. I agree with you that I am telling, whenever Western, it is not Westerners. Even if I am an Indian and my orientation is what do you call, not Oriental but Occidental. That's what I'm telling. It's not the nationality, it is not the place of origin or anything. It is a question of how you are oriented, whether you are oriented to understand that science in that way. If I tell that, no, I have to understand that in my own language and in my own concepts only, or in my own way, the way I wish to understand, then it is difficult. That is what I am telling. So when we are oriented to it, when you are inducted mentally to understand something, this is the concept of this science, or this is the thing. And this looks, the perspective is like that. The priorities in that science is not this, but this one. Once you understand that, it is. For example, I'll put one where Prasadji may be able to add, or Kishorji may be able to add that. See, Ayurveda has a concept of srotas. Dhatus are there, srotas. But at one point in Ashtanga itself, when srotas are mentioned, Sroto Dushti Lakshanas are told, Sroto Dushti Karanas, the reasons for the Sroto Dushti are told. But when it comes to Chikitsa, Acharya will tell that you understand the dosha behind it, it has to be treated like this disease which has a predominant this Srotos disturbance. So he does not go into the break down the Srotas into then organs and then the organelles, etc. He comes to the holistic, comes back to the, whenever the word Sukshma Samikshesham Dosha Oshada Nirupane, Yo Vartade Chikilsayam Nachaskaladi Chadujit, when Ashtanga tells that, that is the Dashavita Parikshas have to be understood Sukshma. He tells that Dosha Oshada Nirupane, Dosha Nirupana, Oshada Nirupanam has to be done. Nirupana means critical analysis. That is where Ayurveda becomes more logical and analytical and scientific. So this is told, and this is the way it is. It has to be done. But what happened is that in Ayurveda means more of people started more of hearsay and depending on miraculous cures or anything like that, and then the fundamentals got lost. I think he is. It is very clear that according to the fancy of my interest or this thing, if I talk Ayurveda, then it becomes useless, or it's something which is my. So that does not carry away. Even people are playing too much with leaving the. See, in Indian sciences, there is no division between materialism and spiritualism. That concept itself is, when Marma is concerned, whether you are a spiritualistic viewers, whether you are a materialistic viewers, you are together only, and there is existence in, when Chaitanya is there, you are both materialistic and spiritualistic. So if you are looking from a science where something is called spiritual, another thing is called material, then it's difficult to understand. That's what I meant. Okay, so I think I...
Thank you, Dr. Srivastava.
Thank you very much.
Thank you. I just
Can I
want
just
to bring...
add...
Leah, please, I wanted to bring...
Oh, I just wanted to
Sintija
add one
this,
little...
please, yes.
I just
Leah.
wanted to add one little tag onto that puts it into perspective. I did have a hard time hearing some of that.
Yes.
But what we're seeing now in America is that even in Ayurvedic colleges, and definitely in yoga schools and studios and colleges, the anatomy is being taught all within allopathic language. And then that translation is completely lost, I think. Right? So we're seeing that. I almost see that as a side effect of everything that we're talking about, because I don't think any of us would know how to teach students or practitioners that have only been introduced to anatomy from an allopathic vision. I don't know how you stick, as other people have mentioned, Ayurvedic concepts onto that.
Leah, I have a... Leah, sorry to interrupt you. I have a question, very sharp question here. If somebody like Vaidya Prasad or Srivatsji were to offer their services to advance the teaching in some of these, America, we have so many colleges in Oregon and California, etc., etc. And more importantly, in the bigger schools, UCLA, etc. What do you think is this something you think about? Is this the kind of, is there a mechanism there? This is also for Bhaswati because she is trained in some of the best schools in America. What we are hearing here, we are so fortunate to have you here with us. We are so fortunate to have somebody like Kishor or Prasadji or Srivatsji. And this is a very unique kind of interaction that's going on. Now, can this be advanced to the next level? And is this an easy thing to do? Because you are deeply engaged in these issues in America. Could you throw some light on this, Leah? And I'm being a little, my mind is saying there is a possibility. And I'm trying to play this. I'm trying to play this for the Ayush Valley, and I want to see if the Ayush Valley can be that agency that will bring this marriage.
There is a way.
So Mia, thank you.
I think there needs to be a way, and there should be a way. And I think that the depth of learning and the enthusiasm of learning is there at times. But what we're seeing is what we're seeing is very similar to what you're talking about in India, that a lot of these programs are extremely dogmatic, they're very rigid, and it's even difficult to speak to students of Ayurveda in colleges about the fact that a Western anatomical view might be, I'm just going to be blunt in this forum, might be a little shallow, or even like neglecting of an overview of Ayurveda that somebody might need to complete their education. So I see it as both. It's extremely needed, and on one hand, there's great enthusiasm. And then the other hand, in the structure of these programs, there's already a built-in rigidity, a built-in egoism, and a lack of amazement for the depth or the history of Ayurveda, and more a desire for people to say they have graduated this program or that program. So I see both, and I think that's why we're having this discussion. We live in a culture here where the predominant view is still X treats Y. You know, this thing treats that thing. And as all of you have been saying so beautifully, it's just been beautiful to listen. When we live in that culture, it's a culture of not enoughism. It's a culture of otherism. And there needs to be this paradigm shift that we're creating for principles of energy and the energetic principles of self that are allowed in our biology to really be presented in an educationally viable forum. I could go on, but I know Bhaswati had something to say.
One of the realities that I see in the education system in India is that the people that are learning in the MBBS system learn anatomy in a certain way, and the people that are learning anatomy or Rachna Sharir in the Ayurvedic colleges, and I've only seen about 10 colleges in India, but they're learning it in another way. If you go to what's happened in America already, there is one model where students are learning not to just cut cadavers and learn anatomy, but to use yoga, where they show up in very short, shorts and tank tops, and they learn pronation, supination, and they practice on each other. So they're learning what the dynamic human body living is versus the dead body, and they're learning how to integrate yoga therapy. We also have osteopaths who look at the spine and the relationship of the nerves in the spine and where they meet the end organs, and the relationships of the bioenergy of the body as integral to the anatomy. We also have curricula like I had, where we didn't have anatomy class and biochemistry class and physiology class. Structure determines function, and function determines structure. So we learned it in an integrated way. And when I learned it in an integrated way, I was surprised to come to India and see that people are treating anatomy very, very separately from physiology in the Ayurvedic colleges. When the Udupa system set up different parts of Ayurveda as different specialties, they took away the holism and the holistic way of learning all of the arts together. Then I went to AVP and I saw how it's taught in a very integrated way by Vasudevan sir and Krishna Kumarji and Srivat sir and Indulalji and all of my teachers there, where they absolutely say that structure determines function. And the dhatus were integrated with the understanding of tissues, with a definite idea that dhatu poshaka cannot be understood by calling them as tissues. So there are already models that are out there, but people in these curriculum committees do not make sure to find out what's already out there that works. The Hofstra program that has the first 100 weeks and the second 100 weeks is a fantastic model. The McMaster program in problem-based learning, where we just learn about problems after injuries and how the biochemistry and the anatomy and the physiology interface with so many different of the medical sciences. There are many CAM programs which are integrating anatomy, physiology, and are bringing in yoga therapists, bringing in acupuncturists, talking about the meridians and the evidence that is there for meridians energetically. All of this is already happening. What's not happening is that the educational committees are not calling to the table people who are aware of what's already going on. That is the, what you're saying, you know, the possibility that might be out there. It's already happening. They're just not ready to listen to us because they're stuck in that paradigm that this is the way it is because that's what they learned back in the 1960s. Thank you for listening to me.
Prasad.